Morning, everyone. Pleasant day to all of our friends, relatives, patients, and students alike. Um, Mr. Lochan here at the lab, and I wanted to share something with you that might benefit someone, might edify someone, give them a greater knowledge of what's happening with their health. As we know, the medical lab deals with different types of tests. We may be familiar with blood tests being drawn from us, and kidney and cholesterol and liver tests, thyroids, etc. being done. But there's another department in the lab that investigates other types of specimens, especially non-blood specimens. That is the Microbiology Department. Ology is the study of. Microbiology is the study of microorganisms. Firstly, I must say that microorganisms, with respect to human health, many times our bodies will have as normal a certain degree of organisms that are found there. They do not contribute to disease. As a matter of fact, some of them actually are required to be there to ensure that the patient is in good health. For example, organisms in our gut help in the digestion and the digestive processes. Even there are some organisms in the genital tract of a healthy female. One of it is called lactobacilli. Its job is to help maintain an acidic pH in the genital tract of the female. And that acidic pH helps in the management or keeping down of other non-desirable organisms. All right. So, but when the equilibrium shifts with respect to infection, when the equilibrium shifts for whatever reason, diabetes, poor sexual orientation and practices, poor hygiene, immunocompromised states, unnecessary use of antibiotics, many different factors as well, but these are some of the common ones. What happens is maybe even a break in the continuity of the protective barrier of the skin. Infection can set in. There are different types of microorganisms, even though many of us might be biased to think that bacteria is the first and biggest culprit. That is correct. But there are molds, fungi, parasites, viruses, to name a few. But the biggest culprit with respect to infection in human health and disease at times is the whole group of organisms called bacteria. Now, what happens in the microbiology department is a test. One of the most important tests done there is a test called the MC&S, microculture and sensitivity. Regardless where a particular infection may occur, what body site, when a physician examines his or her patient and counsels them and recognizes that there may be a pathogenic or disease-causing organism there, that physician may choose to get a sample from that patient, maybe the nose, maybe the throat, maybe a wound, vaginal tract, penile area, perianal area. Even if it's a UTI that they suspect, they're going to ask to get a sample that is reflective of that body site. So these specimens can be urines. Specimen can be semen, seminal samples. It can be swabs taken from different areas. I want to tell you this. The reason why a patient has an infection due to a microorganism, whatever may have precipitated it, it is managed or sustained by factors such as warmth from the body of the patient, moisture from the body, and nutrients from the body. The blood, the tissue, fluids, and all of that sustain these infections. So what the microbiology department does in the lab is it tries to imitate a growth environment by supplying these organisms with agar plates. Fortunately, I'm in the middle of a cycle right now making up these plates. But these agar plates, and this is what one looks like that has no organisms on it. All right. Now, these different specimens, whether it's a seminal sample, a urine, a swab, they are inoculated onto these plates. And after they are inoculated, they are incubated in an incubator to provide the temperature that is optimal for the growth of the organism. After incubation, these plates are taken out and examined. I've got a lot of them in front of me right now. And these plates are examined for significant growth or for growth at all. When these growths are identified, they are subjected to tests And also in the S, which is the sensitivity part of the MCNS, these microorganisms, when they are bacteria, are subjected to a panel of antibiotics. Antibiotics work against bacteria, antifungals work against fungal infections, and antiparasitic work against parasites. So you've got to know what it is you have. Your physician needs to know what it is you have in order to assist you in treatment, management, or cure of that particular infection. So swabs, urine, any material is taken, inoculated onto these plates, and these plates are then examined. But the S in the sensitivity, what it means there is antibiotics are subjected. Antibiotics are subjected to these organisms, after which a decision is made and a test is done where the antibiotics that can be used to kill that organism is placed or recorded as sensitive, and antibiotics that won't work will be recorded as resistant. Therein lies the complete report that is issued to your physician. At that point, the physician knows what the organism is, and the physician knows what prescription to write based on the laboratory report saying that the organism is sensitive to ciprofloxacin, augmentin, gentamicin, tobramycin, whatever. You see, just to let you know that there are different categories of microorganisms, and organisms in different families act a certain way. Just like us, we have some similarities amongst our families. And then also similarly too, unfortunately for us, the pharmaceutical industry with its antibiotics, they've also got categorizations and groups and classes of antibiotics that work in particular ways, maybe to damage the cell wall, maybe to prevent certain proteins from being synthesized, certain enzymes from acting, maybe even preventing them from multiplying. All of these things are working in tandem in the medical industry. And this is why patients must submit themselves to the counsel and the guidance of their physicians. And this is why physicians also must depend and continue to depend highly on the laboratory. I wanted to create a little synopsis here that in terms of infections, a specimen will be required. Urine, semen, stool, sputum, swabs of any different areas of the body. These specimens are taken to the microbiology lab and they are done or processed through a test called the MCNS. You're going to see that someday. You may have already seen it. Microculture and sensitivity. The C is for culturing, where the specimen is inoculated onto plates. The S is the sensitivity test, where antibiotics are subjected, and what these antibiotics look like are, well, in this laboratory, we've got antibiotic ring structures. Antibiotic ring structures, where each one of these circles is an antibiotic, that a disc that has been impregnated with an antibiotic. Cefepime, amikacin, ceftazidime, cefuroxime, gentamicin, all of these. And these are placed on another plate where the organism was seeded or placed. And then we look for what is called zones of inhibition. That is what is going to tell the physician to write a prescription for that antibiotic or another one, etc. We understand that in some instances, this whole process is bypassed when a physician feels that the patient's health and life is seriously affected and needs a greater move towards management with antibiotics. So they make a best case judgment where they know some antibiotics work against certain types of bacteria. So they make a preemptive strike and they give that antibiotic prior to any microculture and sensitivity. Unfortunately, a microbiologist who I was fortunate to have crossed paths with, Dr. Swanson, indicated, and he used a phrase, it's called poor antibiotic stewardship. Many times, because of what is causing the development of multi-resistant bugs worldwide, is a couple things. Too easy access to antibiotics, too easy access to improper antibiotics, the lack of adequate testing using the MCNS, where a definitive result is given with what antibiotics can be used and which ones should not be used, and then also from the patients. Sometimes patients are given antibiotics to use for 7 days, or etc. And on day 4, or day 5, when their symptoms have receded, they believe that they are out of that infection and they stop. When the last residual set of microorganisms, the bacteria there that are the stronger ones, needed to be subjected to the last 2 days of antibiotics, the patient didn't do it. So what happens? You now have a growingly stronger breed. And therein lies the reason why microorganisms remain, like bacteria. Some organisms like Staph aureus and others are resistant to many antibiotics. So I encourage you to submit yourselves to the hands of your physicians and be aware of the microculture and sensitivity. It is a very scientific test where the organism is identified, where there are many different types of bacteria, and based on what type of bacteria, the organism is then subjected to antibiotics, where a report is given saying the organism's name, in addition to what it is sensitive to, what it is resistant to, and then physicians now can write prescription, which is in their domain, for patients to issue to the pharmaceutical department. All right, I hope that has helped you. Look after yourselves and keep well in your aspirations. Have a blessed day.